Welcome, everyone. My name is Brian Brown, and I have the privilege of serving as the program chair for the 2021-2022 academic year for the program on race, inequality, language, and education. We are excited to have everyone join us today for our fourth session in the 2021 conference. This year, we are exploring ways to think beyond the defaults to norms of what's happening in education. We have a special treat for you today. Today, we're going to hear from two incredible scholars who are going to be talking about school-based trauma. We think of schools as places that affirm young people, places where students are made to feel loved, but that's not always the case. And today, we have the opportunity to hear some innovative research about what is actually happening at schools. The title is Beyond Harm, Confronting School-Induced Trauma for Students of Color. And you're going to hear two micro talks. So these are 10-minute versions of research so you can get the big ideas from two incredible scholars, and then we'll move to a panel session. To give our scholars the appropriate introduction, I'm going to bring forward one of our incredible graduate students, Ruben Gonzalez. Ruben is proudly from Greenfield, California. He is a second year RILE student who is interested in students of color and how they identify, how they navigate these spaces, and how structural oppression plays a role in school. So Ruben, I'm going to ask you to come forward and thank you for being our moderator today.
No, thank you, Dr. Brian Brown, for this fantastic opportunity. And welcome, everyone. Thank you for joining us at this year's RILE conference. And today you're in for a treat. You have two leading figures in the world of educational research talking about a very important topic that's relevant to all students. So first up, you will hear from Dr. Farzana Saleem, who's an assistant professor at the School of Education here at Stanford University. Dr. Saleem's research examines the influences of racial stressors and culturally relevant practices such as racial socialization on the psychological health, academic success, and well-being of Black adolescents and other youth of color. Next up, you will hear from Dr. Tyrone Howard, who is a Pritzker Family Endowed Chair and Professor in the School of Education and Informational Studies at the University of California, Los Angeles. His research addresses race, culture, access, and the educational opportunity of minoritized students and populations. Professor Howard is a member of the National Academy of Education and an American Educational Research Association Fellow. So it's a pleasure to introduce Dr. Farzana Saleem for her micro talk.
All right, can I have a thumbs up if you're able to see the screen and slide okay? All right, it looks like we are ready to go. Hi, everyone. I'm excited to be here with you today to get us kicked off on this topic. I'm actually going to start off with some general information about adversity and trauma, and then we're going to dive into thinking a bit more about identity-based trauma and specifically racial stress and trauma in schools. So to start us off, these statistics I think are very telling. So we know that each year, more than 10 million children in the United States experience trauma and adverse events. About 26% of children in the United States witness or experience a traumatic event or witness it before they turn 4. And we know that about 12.5% of youth will experience 4 or more adverse experiences by the time that they turn 18. We also know that these are underestimates because typically we're not getting all of the information that is out there in terms of accessibility to this particular population. When I talk about adverse childhood experiences, I want to make sure we're all on the same page with some of these terms. It's referring to a wide range of potentially traumatic events that occur in childhood. I also want to acknowledge that many youth are resilient, right? So some youth can experience adversity and be able to bounce back because of coping skills, support, all of the things that we know promote positive adjustment. And at the same time, trauma is one possible outcome to adversity. And we know that experiences with trauma and adversity can impact psychological, social, cognitive, physiological, and academic consequences, and that these experiences can have impact over the lifetime, and particularly so when they occur earlier in life and when they are severe and accumulate. So common examples, I think folks often think about things like physical abuse, right? Psychological abuse, disasters, community violence. But we also need to have a conversation about less common forms of adversity and trauma that are discussed. And one is identity-based adversity and trauma, right? And so for the purposes of today, we're going to be diving a bit more into racial stress and trauma. And we know that racial stress and trauma is one factor that might be accounting for this increased prevalence and risk that we see for adverse childhood experiences and trauma exposure for youth of color. We also know that with daily diary studies, that youth are reporting multiple encounters with race-based stressors multiple times per day. So for example, a recent study with African-American adolescents found that on average, African-American teenagers were reporting about 5 encounters with race-related stressors per day, right? And so that is something to really think about in terms of how we are responding to and managing that. I also want to acknowledge the fact that there are intersecting forms of oppression, right? So these numbers might look different when we look at daily diary studies, when we talk about multiple aspects of a child's identity and intersecting forms of oppression. Again, today we're leaning into this lens of racial stress and trauma, but that is important to think about as well. And so there's this need to really consider the place that adversity and trauma holds within social power structures and how these experiences occur across contexts. And it's important to also think about how these outcomes or how these experiences influence outcome, right? Influence outcomes for students, because adversity and trauma can impact engagement, and it can also influence all of these outcomes we see here across domains, right? So psychological, academic, cognitive, social, and behavioral. And that again, these experiences can potentially have impacts across developmental lifespans. And so when understanding youth, I think we also have to really look at schools as a salient context, because schools are a context where youth are not only learning or should be learning, but it's important context for development and socialization. Also within schools, we know that student behavior can be misinterpreted, overlooked, mislabeled, or even misunderstood, both by staff as well as teachers and mental health professionals. Also, we know that students are bringing in experiences outside of the school context, but that they are also contending with adversity and trauma within schools from multiple sources. We also know that students of color, particularly Black youth, are vulnerable to individual and systemic experiences with racism in schools that could be stressful or potentially traumatic. In fact, some scholars are talking about the fact that trauma might be one of the most underexplored racial equity issues within education. And so when we start thinking some about ways in which trauma manifests and racial stress in particular, and trauma manifests within schools, to give us some examples here, we might think about things like microaggressions, racial bullying, racial teasing, triggering content, or even having colorblind racial ideologies. We also know that we see racial bias and disparities within larger practices and policies within schools that impact our students, such as discipline, tracking, achievement. And again, there are a host of studies that link this to negative consequences across domains for students of color. And we also know that while youth are learning about topics perhaps of race and culture and history within their coursework, they're simultaneously having these firsthand encounters with racism and racialized experiences. And we all know that racial socialization is happening in schools, right? Sometimes it is direct and intentional, and sometimes it's not. But youth are not always taught about how to be able to recognize, analyze, and respond to racial inequities and bias within the school setting. And this is a particular limitation, right? So oftentimes when we look at studies that are examining school staff and teachers, there are data that are showing that oftentimes staff may not recognize or may not feel prepared or don't know how to prioritize race-related issues. Oftentimes there are competing demands, but then there's also sometimes a barrier of how do I do that? And we think that school staff and teachers and other folks within the school context are actually missing an opportunity to be able to reduce the encounters with race-related stressors, and also missing an opportunity to promote healing and foster a healthy racial climate within the school context. Unfortunately, to date, there's really limited understanding of how racial stress and trauma fits within traditional school-based trauma frameworks, and really how to address this across multiple levels of the school ecology. And so it's really important that schools are starting to recognize both societies and schools' roles in perpetuating or even recreating trauma, including racial justice at its center, right? And so while current models really emphasize supporting students who have experienced trauma, we must also go further and think about these multiple levels in which this needs to be addressed, right? So thinking about structural racism, thinking about disrupting inequitable conditions. And we know that most of the time our students of color are shouldering the burden for this. And so I want to shed light on a new model that myself and my colleague, Tyrone Howard and Audra Langley have put together, and you'll hear from Dr. Howard in just a bit. And it's the School Trauma and Racial Stress Blueprint. And so the goal of this blueprint is to be able to comprehensively and explicitly address the role of racial stress and trauma within this school-based trauma-informed lens that we often see. And so what we've done within this model, and again, we'll only be able to touch on pieces of it today, given the length of time, but we expand on these 6 core empirical principles from SAMHSA's trauma-informed elements, and we have adapted them to think about how do we make these principles anti-racist and trauma and healing informed, and thinking about the role of that to multiple school-based services. And again, today we'll be focusing on just some of the ways that schools are perpetuating and can mitigate some of this harm. And we're thinking about this within a multi-level school ecological lens. So this is a whole school trauma approach, both for individual and school-wide healing. And so within this multiple level ecological lens, we can start to think about having students at the center, thinking about the role of staff and teachers, and we can also think about systems, policies, and practices. And we, of course, have to give acknowledgement to this larger external school ecology, right? So we understand that there are experiences that are happening, both general and race specific, stress and trauma to students outside of schools, and students are coming into schools with that. And we also recognize that there are experiences that are being fostered and happening and perpetuated within the school context, such that that might be exacerbating the impact of trauma and adversity on students. And so what can we do, and how can we think about addressing this and think about healing across these levels of the school ecology? And so I'm going to get us started and briefly talk some about this student level. And so when we think about the student level, we're thinking about equipping students. Again, this is one level within a larger level in terms of how we're thinking about approaching and healing adversity and trauma for our students of color. So one of the recommendations that we talk about based on empirical evidence, based on theoretical models, we outline different strategies and steps, right? So one strategy is promoting or creating opportunities for students to identify and analyze racial injustice and these intersecting forms of oppression, right? But in order to do that, we have to be able to create safe and healing spaces so that students feel comfortable to share and feel comfortable to be able to process that within the school context, which isn't always a safe environment. In addition to that, we can think about providing skills to students in terms of how to respond to racial stress and trauma. Oftentimes we see that families are the first contexts that generally provide this type of socialization to students, but there's also a role of schools in that. And so how can schools think about providing strategies, behaviors, and how are they conveying those messages? We also should be thinking about how are schools developing healthy self-concepts, particularly around ethnic racial identity and adjustment when we think about racial stress and trauma, in addition to fostering these anti-racist attitudes and actions that focus on building not just that cultural pride, but in addition to that, thinking about how do we foster cultural appreciation of other groups. And in addition to that piece too, we want to think about providing access to resources and activities that really focus on radical healing, resistance, and self-care. And I know that we will have a bit more time to discuss some of these things and do a deeper dive if need be, but a few other things that are important to think about here, right? So when we think about the student level, we know that some of that might happen with the initiation of students, but that largely a lot of what I just discussed at the student level when we talk about this healing process should be fostered throughout these different tiers of the school ecology. And there are different ways to do it, right? So there are formal and informal methods that can be utilized to promote this radical healing, cultural pride, cultural appreciation of other groups. And we know that interpersonal interactions in school ethnic racial socialization in particular can help enhance positive school racial climate, and that these factors are associated with student outcomes. And so we need to think about how can schools directly address racial stress and trauma? How do we build racial literacy? And how do we create race-conscious pathways for supporting students experiencing adversity and trauma? And so the STARS blueprint was a call to action for system level change that has this tiered approach. And so we are thinking about how do we expand the school-based trauma-informed approaches to really be inclusive of and taking into consideration racial stress and trauma across all of these levels, because we believe that this is critical in promoting racial equity and resilience for youth of color within K through 12 schools. And we also believe that schools can be a context in which to intervene in order to reduce the perpetuation of harm, and also thinking about how can schools really reflect on and take a commitment to addressing the adversity and trauma that can be induced within the school context, and thinking about how can we change that for schools to be able to heal. And so now that I've gotten a chance to give that overview and talk some about the STARS model and how we're thinking about healing within the student context, I'm going to turn it over to my colleague, Dr. Tyrone Howard, to talk a bit more about the other ecologies.
Thank you so much, Farzana. I want to first start off by saying, first of all, job well done. Important work that you shared here. I want to also, before I get into my comments, say big shout out to Professor Brian Brown and his entire team for the putting together of this conference. I know that having attended for a couple of years, it's one of the highlights of the year. And big shout out as well to my dear colleague and friend, Professor Arnitha Ball, who was often seen, who is one of the brainchilds, if not the brainchild behind this work. So I want to pick up off where Farzana was in terms of confronting school-induced trauma, in particular racial stress and trauma, because as she talked about it within the context of students, part of what our model also engages or really sort of explores is the way in which it also has an impact on educators as well, educators of color in particular. So I raise this in light of the fact that there has been a growing number of studies and an increasing amount of data that talks about educator stress. There's a recent survey that came out from Education Week that talked about 60% of teachers say they experience job-related stress frequently or always. Close to half said they oftentimes feel less effective at their job. 42% said administrators have not made any efforts to help them, which is a sort of a sidebar for administrators. About a quarter said they oftentimes think about quitting, and 16% said they dread going to work every day. What's missing from these data and what's so important to lift up is that these data sort of speak to the concerns and stresses of teachers across the board. What they do not lift up are the unique experiences that teachers of color face as they live in this current moment of pandemic, et cetera. So part of what the model does is begin to really speak to some of the unique challenges that we know teachers of color face. So what we know nationally is about 20% of teachers of color move schools or leave the profession annually, compared to about 15% of white teachers. So what we are also learning now with a report that came out from the Learning Policy Institute, that in the past year, that number has increased even more, meaning that we are seeing a greater exodus of teachers of color from the profession compared to white teachers. That's raised because many schools across the country keep sort of framing this argument around the need to have more teachers of color. There's some data that tells us that students of color perform well when they have teachers of color, but there's also a pipeline issue because we know that principals and ultimate school leaders, district leaders come from the teaching pipeline. So this issue around why teachers of color are leaving is important to interrogate if we're going to really try to create the more diverse and inclusive schools that our students so desperately need and want. Now, what's not talked about in the literature and where our model comes into play is that what's not being talked about is the added stressors, the invisible tax oftentimes in some sort of called the Black and brown text that teachers of color face in schools as a primary rationale for why they are exiting the field in the way that they are. And part of what we have to begin to understand is what are the protective mechanisms, what are the healing structures that can be put in place in schools that not only are useful for students as they face issues of racial trauma and stress, but also for teachers and staff as they face some of the same kinds of challenges when it comes to racial trauma and stress. Now, we lift this up because when you begin to understand the work of Rita Coley, for example, Rita Coley has talked about that some of the challenges that we see that's very unique to teachers of color is that there's oftentimes this exhausting, unending engagement of racial stress. Having to be the advocate for students of color, having to lift up issues of racism where they exist, constantly trying to engage your colleagues around how to be better and more inclusive around sort of racial considerations and concerns, and how for many teachers of color, there's an increasing desire to sort of not have to be so anxiety driven. They start to feel hyper visible as if they're everywhere or also invisible at the same time, not being seen, not being heard. And so the stress can affect engagement and affect drive, where oftentimes many teachers of color feel like they are superheroes because they have to constantly be the individuals who are trying to enlighten their colleagues, enlighten their coworkers, and in some cases even enlighten their school leaders about how they're not serving adequately students of color. So there's this persistence of feeling undervalued, invisible, and oftentimes under-mentored that has led to many teachers of color that have led to them leaving the profession. So we have to look at what are the interventions, what are the mechanisms that can begin to disrupt the way in which we know teachers of color feel this heavy sort of responsibility, this added tax to be able to respond to students, the same needs that students of color have. So part of what's also unique in this current moment is that Black teachers and staff face what Gloria Ladson-Billings refers to as the triple pandemic. That triple pandemic has been not just the disproportionate impact that COVID has had on communities of color across the country over the past 18 months, but also we see that Black teachers and staff also deal with the racial reckoning with the deaths of George Floyd and Breonna Taylor and all the fallout that came from that, this sort of racial sort of moment of sorts, but also the economic fallout that had a disproportionate impact on Black and brown communities in light of COVID. Then there's also this focus on what Will Smith calls racial battle fatigue, where it's a systemic race-related repetitive injury, constantly having to educate your colleagues, constantly having to check folks about why certain comments and interactions are not appropriate in terms of how you engage with families of color, how you engage with students of color, or how you see yourself doing this work in communities of color. So there's this constant need to teach and explain. And then this decision-making that many teachers of color have to go through. Do I have the energy to have to intervene one more time, to explain one more act of racism, talk about why that's racist, or to explain the microaggressions that might be occurring? So what Ashley Woodson talks about is the need to create these critical counter spaces. And this is the kind of protective measure that we talk about with the STARS model. How do we create critical counter spaces such as the Virtual Freedom School for the Abolitionist Teaching Network that allows teachers of color to come together to sort of support each other, lean on each other, talk about coping strategies, identify healing strategies, create the healing spaces that will help teachers of color understand that they're not alone in this work, they're not alone in these challenges, and to also help them to understand that they are in community or they're in solidarity with other teachers of color as they embark upon these challenges. So the model that we've laid out is, as Farzana talked about, was the fact that the STAR model is really based on some key considerations that we have to begin to put on structures and systems and not expect teachers of color to have to adapt. I raise that because one of the concerns frequently that we hear from teachers of color is that, well, teachers of color just need to be able to not take these things so seriously, or teachers of color need to just find ways to address or respond. So the labor is oftentimes, usually all the time, placed on teachers of color to have to respond to the conditions around them, where less of a critique is placed on how do systems change. So to that end, the STARS model talks about the way in which systems, schools, districts can create safety, collaboration, and mutuality, where we begin to think about what is it that helps to create the safety kind of spaces for teachers of color, how they can collaborate in ways that allow them to not have to sort of carry this heavy burden of always having to educate their peers. It's also about trustworthiness and transparency. And we lift this up in the paper where we talk about what does peer support look like for teachers of color, because we cannot use this one size fits all approach, because the needs and the experiences and the day-to-day realities of teachers of color are different than their white peers. And part of that is tied to this third level, which is acknowledgement of racial, ethnic, historical, and intersectional lived experiences. The kinds of challenges that teachers of color face, the very reason why many teachers of color have gone into the profession and the kinds of microaggressions that they encounter on a day in, day out basis needs to be acknowledged and then responded to appropriately. Again, with the approach being not what is it that teachers of color and staff of color have to do, but how do we change systems and structures and create more inclusive climates that don't put this added labor on teachers of color. And then there's racial ethnic socialization and resolution skills, right? How do we begin to, again, not always have to put the labor on teachers of color, staff of color, to have to enlighten, to have to engage, to have to explain, but how do we think about models that puts this responsibility on leaders, on white leaders, on white colleagues, on white teachers, where they begin to take ownership of how they help to create a more culturally inclusive and racially conscious schooling environment, not just for students, but for teachers and staff as well. So we lift these up in the paper, and I think we are now in a different, even more pressing need, because social media has now entered sort of sector into this conversation, where you see recently, I was in Boston, where on TikTok, there are these dares around slap a teacher, right? I'm sure you all seen it. And these dares are yet another sort of literal assault on teachers. Part of what we're seeing are some anecdotal accounts of teachers of color in predominantly white schools being the individuals who were targeted. Now, you're talking about a completely different framework of what protection looks like now, when you've got TikTok dares that really call for the assault of teachers. So part of what we want this framework to do is to begin to, again, think about how the support of teachers can be lifted up and recognized, but also systems changes as well. And if I could bring one small point of intersection here on the same point, I think what we also have to be mindful of is that when we talk school-induced trauma, we're talking right now about the ways in which teachers of color are having to deal with racial stress and trauma. But let us also be clear, and we talk about this in the paper that Farzana mentioned, that some students of color, the trauma that they face in schools is a direct result from their teachers. So the idea oftentimes being centered on the fact that schools are exempt from inducing trauma on young people, that somehow trauma only comes from the outside. But in many instances, as Farzana's work has talked about, that school curriculum can be trauma-inducing, interactions, expectation, and punitive approaches also can be inducing the trauma of young people. So there's a need for us to think about teachers in general in terms of how we prepare them. And that's where I think we have to think about teacher education improving, teacher education being better. How do we start providing teachers in training with the kind of resources, the strategies, the knowledge and skills to be able to engage in more race conscious awareness and more culturally responsive approaches to principles and practices, so that teachers are not continuing to create the kind of systems and the kind of climates that cause the kind of harm to not only students of color, but also cause the harm, again, I know I sound like a broken record here, but also cause the same kind of harm to teachers and staff of color well. But we have to think about what teacher training programs look like. The challenge in this piece right here around teacher education, we talk about the lack of diversity in K-12 teachers. Well, the lack of diversity in teacher educators is even more problematic. So again, we have structural constraints we have to deal with there. And dare I add, the very issues we're talking about that teachers of color face in K-12 schools when it comes to racial induced trauma, so do faculty of color in teacher education programs and in departments of education. Again, so this has multiple layers in which we see the kinds of racial trauma and stress being manifested. So I think what we've got to do is think about how do we engage in anti-racist educational practice in schools and offices. Training has to be a big part of systems training, of systems change. I think this work also needs to be informed by community needs assessment. How do we begin to recognize the unique needs and experiences that our respective communities have? And then it's got to be cross-system training. This can't be looked at solely from an education standpoint, but there's a robust body of literature that Farzana talks about that comes from the field of psychology that we can lean on. Same thing with medicine and social welfare. And then it's about establishing anti-racist policies, procedures, and ideas that become sort of ingrained in the very fabric of how we decide who is in our schools, who we allow to teach our children, who does the work with other teachers and staff of color. And then this constant process of reflecting on how our decisions as educators affect not only students and families of color, but also the adults who work in those spaces as well. So I appreciate this micro lecture approach that you all have come with here. Thank you, Brian Brown, because you know, as academics, we are oftentimes quite long-winded. So I think this is a great idea to get us kind of to get in and get out and to turn to a more interactive conversation. So I'll stop right there.
No, so thank you, Dr. Tyrone Howard. Thank you, Dr. Farzana Saleem. This was fantastic. As someone interested in teacher education, as someone that was pushed out of high school, like it resonated with me in so many. So I'm in all the fields right now. So thank you both for your important work. So right now we'll open it up to questions and answers. So folks, feel free to drop your questions in the Q&A feature, and then we'll try to go ahead and answer all of them. So, but I do have one question to get us started. And one thing that I'm wondering is, should we be focused on the prevention or intervention of addressing trauma in schools, and also like who's the we, right? So who should be involved and what might this look like? So we could have one of you answer first, and then we could just popcorn to one another.
Okay, Dr. Saleem, you can start us off.
All right, yes. So I argue that we need to do both, because even though we need to be shifting towards prevention, how do we prevent this from happening? The reality is that this is currently happening, like in our schools, in the lives of children and teenagers. And so I think that we need methods that are going to be able to help us resolve and address or take steps towards resolution in the moment. So that might look like interventions, that might look like training, that might look like re-examining policies and practices within schools, within districts. That could also be thinking about preventative measures, right? So how can we do some of those same things, but thinking about prevention in terms of early, which I know Dr. Howard's work can get at, some of this teacher education, right? Or even thinking about training of the school counselors, and how do we think about equipping schools with mental health professionals to respond to these issues, but then also helping staff that are already existing within schools to be aware of these issues earlier on.
Yeah, I agree with Farzana. I would add, Ruben, to your question about who is the we. I think the we is everybody who's involved in the education space, right? I think it's for those of us who are on the research side, how do we research and identify evidence-based practices on the prevention side that have potential and that have shown results to be effective, but also how do we look at interventions that are shown to be effective as well. But I also think there's also something to be said about those involved in principal leadership training. I think the way we prepare school leaders, this has to be a sort of a vital part of the training. You should not be able to be credentialed or to earn certification as a teacher or principal if you have not shown some degree of proficiency around, sort of racial consciousness and the effects of racially based trauma. You just shouldn't be. We expect leaders to know how to handle budgets, how to handle personnel, and to understand legal kinds of challenges in schools. But we think in this moment, you also have to have approaches that says if you don't bring sort of a race conscious lens to how trauma gets manifested in schools, then you're not equipped to be in front of students or equipped to lead schools. So I think the we is everybody, and I think each of us has to find our respective lanes in terms of how and where and with whom we do this work.
Mm-hmm. No, thank you both for that very thoughtful answer. So one question that came up in the chat is, how could this work be implemented with regard to incarcerated youth and the education that they receive?
Well, I think if I can jump in while Dr. Saleem is processing, I see a wheel spinning there. I think what we have to do is, first of all, acknowledge the traumas that incarcerated youth have already encountered in the first place, right? Because the whole process of being incarcerated has its own set of unique challenges associated with trauma. But then what we cannot do is pathologize those individuals who have been traumatized to incarceration and punishment. I think we have to have culture responsive kinds of healing practices. But the challenge with that is, even as we see numbers of young people incarcerated going down, the model of punishment and the model of incarceration that's currently in place is not designed to heal. It's not designed to really rehabilitate. It's designed to punish and re-traumatize. And so I think we have to rethink these models. And that's why we have to make sure we're being intentional on stemming the tide of dismantling, disrupting the flow of young people who are pushed out of schools, because we know about the correlation that exists between students who have been pushed out, suspended, and expelled, and those who oftentimes end up in incarcerated situations and structures.
Yeah, I completely agree with that. I think the other points I would add is definitely thinking about the school to prison pipeline. How do we think about that connection there, and how schools and other systems can be a point of disrupting that? And then how do we also focus on healing in terms of, from a part of my lane, in terms of mental health and in terms of rehabilitation, right? Because so often as we talk about trauma and adversity is overrepresented when we look at the numbers and statistics for youth youth who are involved with the juvenile justice setting, we have to think about these systemic issues like racism, but we also have to think about things like ACEs and childhood trauma, and think about how those things might have been mislabeled, right? How those things can contribute to children's experiences and how they interact in the world, and then also how others perceive them. So I think oftentimes there is mislabeling and misunderstanding that's happening as well. And so that's a piece that feels important. I know that there's a colleague that there are several colleagues who are doing work in juvenile justice and thinking about how would we get interventions like focused on racial stress and trauma and healing. And I'm involved in one of these interventions in across not just schools, but also within the juvenile justice setting. So that might look like training folks who work in these settings to be able to provide healing focused practices. But I think that that's one part of the puzzle, and that we do have to think about the larger issue of how youth are even getting there, and then the reducing that, right? And reducing the perpetuation of trauma within those systems.
No, thank you both. So another question that came up is if you both could elaborate on how COVID and the resulting consequences associated with that has given people more urgency to not just address trauma in schools, but also student and teacher mental health more broadly.
Yeah, I mean, it goes without saying. I think that given what we've all been through for the past, 18, 19 months, there's a level of trauma we've all encountered. So while we've all been affected, we haven't all been affected in the same way. We know that COVID has had a really disproportionate impact on communities and people of color. And so that has to be lifted up, because I think historically, many communities of color don't think about the need for therapy. We don't think about the need for, mental health interventions. And I think that has to change. I think we're having different types of conversations now, and it's needed, because if you look at the data from the Center for Disease Control, suicides by young people has increased steadily, and it's been young people of color who have had some of the fastest growing rates. So if that's not a sign for us to say that we have to begin to talk about trauma, race-based trauma, I think I don't know what is. And I think in this moment, we have to begin to normalize talking about mental health, normalize the ways in which trauma affects, talk about the normalization of trauma, that is not acceptable. And this is where Farzana's work has been really important to say we have to begin to sort of bring psychology into conversations with education in ways that historically that have not always happened, with race as an intersectional point as well.
Yeah, absolutely. And I heard a statistic that was on NPR today that even talked about the fact that 140,000 children lost a caregiver this was data that was, I think, up until June of last year, and that there were 65% were ethnic minority youth. And so again, when we think about the compounding trauma and the compounding adverse experiences that youth of color are burdening with COVID, right? When we think about access to care, when we think about the ability for students to be able to be in schools and learning, I think we have to consider the urgency of which there are real concerns about how disparities might be widened in many ways, like not just thinking about academically, but also thinking about mental health, right? Thinking about ways that families might have to be working differently or working harder to catch up with disparities that might be growing through this time. And so I think that there's an urgency of figuring out what do we do in this moment and how are we going to respond? Because we knew that these disparities already existed and that they're widening. And so what action are we taking to be able to respond to this widening disparity across these different levels, right? And so thinking about academic and education, but also thinking about mental health as another important one within the context of this conversation today.
No, thank you both. So here's a question in relationship to teachers, the trauma that they endure, specifically with regard to racial reckoning. So a question in the chat is, how could we address the anti-CRT outcry and anti-mask hysteria in the larger umbrella of trauma that teachers are facing?
How much time we got for that one, Ruben? That's
You all give me 2 minutes right now.
And we have a whole session on it tomorrow too. So
I think that's where, again, teachers are scared now to even talk about issues tied to race because of the anti-CRT sentiment. Anything that's tied to race and racism is seen as a CRT moment, which again leads to higher levels of angst and anxiety and stress for many teachers of color, because teachers of color are expected to be the ones to explain it. Teachers of color and staff of color are expected to be the ones who are promoting and talking about issues of race and racism in their classrooms. So I think this is where I keep coming back to leadership. Leaders have to provide protection. Leaders have to provide cover to allow teachers to do their jobs in a way that recognizes the degrees to which race and racism has been part of what we should be doing in classrooms, talking about in classrooms on a regular basis. The anti-mask hysteria, I'll let Dr. Saleem handle that one. That's a whole nother matter.
What would how folks are responding to that? Ruben, could you remind me of the question one more time with the anti-mask?
Yeah, just how do we address the anti-CRT outcry and anti-mask hysteria in regard to trauma that teachers are enduring at this moment?
Yeah, that's another challenging one, but I think that we have to think about the safety. For me, safety feels like that's one of the most important things here. So how do we keep as many people safe as possible? And so there has to be some regulation from higher up in terms of whether that's, again, school leadership, or whether we're talking about more local policies or state or national, depending on the way that you're looking at mandates for protection. And I think that it's something that teachers and staff and even students are struggling with, but the resolution for it, I think that is challenging depending on the environment that you are in, the context you're in. And so often decisions around that are informed by local policies and local practices and or statewide. And so I think that to me sheds light on the weight of the system and the system level and how that trickles down to impact teachers and to impact staff, and often trickles down to students, where oftentimes it might feel like students or staff or teachers don't have as much control. And even when it comes to thinking about their own safety, they have to rely on what the leaders above them are mandating, right? And they might feel like they don't have this sense of control. And so the part of even the STARS blueprint, we talk about trying to make let there be more equity in terms of hearing people's voices, and think about equity in decision making. How do we elevate maybe the voices of students and teachers within the school context to have them be able to express how, maybe resolutions, solutions, their feelings around this, and there might be opportunities to come together and think around that.
No, thank you. So another question that we have is that, given that students only spend a portion of their day in school, how can schools work with outside school entities to address issues of racial stress and trauma?
Yeah, I think one of the things we're starting to see emerge more in not only in California, but across the nation, are community schools. I think community schools can be one of the steps we can take, and community schools are ways in which we begin to utilize community-based resources such as mental health supports, other kind of medical concerns and considerations, and house them at schools. Because what we can do is we can't always give these handoffs to tell parents and caregivers to go seek services here, seek services there. How can schools serve as anchors or hubs to be able to have many of those resources in one place? Because we know that the needs of young people are complex, and we know that schools cannot be expected to do it all alone. But if schools were able to work in conjunction with other entities in their respective communities, then you can start to see more addressing of the other kinds of needs that are affecting students' abilities to learn. The challenge in that, though, is the fact that we know that lots of Black and brown youth oftentimes are residing or attending schools that are in resource deserts. So when you think about the fact that, we say community schools, but if the community that the school is located in is lacking in terms of essential resources for mental health supports, for medical supports, for vision supports, and things that we know are vital to students' learning, then we're not going to be able to tap into the holistic needs that students have. This is where, again, systems level change has got to be in place, and we cannot expect schools to be at this alone. It's a beyond the schoolhouse kind of approach, right? This is where pressure on elected officials, policy and legislation has to be enacted to ensure that those communities, especially, and this is an area we don't talk much about in California, rural communities in particular, where we see large numbers of folk of color, but who reside in communities that have been largely sort of neglected by our elected officials, largely neglected in terms of federal and even state investments. And so I think we have to begin to think about systemic change that says, how do we start to allocate significant amounts of dollars in those communities that have been historically underserved and overlooked?
Yeah, and I think that we know that there is data that also shows that a lot of students school is one context where students are accessing services around mental health, but there's still a shortage there. And we often find that sometimes schools might have one school counselor to tons and tons of students, right? And so I think that that is one particular avenue to consider. How can we, again, think about building a model where schools can be this source of support, but that is one avenue. And also, oftentimes families might feel marginalized from understanding, or I guess disconnected might be a better word, from being able to be engaged within schools and feel like they have a voice, especially when we think about families and parents of color. Thinking about ways to bridge gaps and build bridges, I would say, among community issues, also around families having a seat at the table in these conversations, and how can we make schools a more welcoming place and more accessible to families of color who oftentimes may not feel as heard, may not feel as visible within the school context, because we know that both the families and schools are two big contexts for youth development, adjustment. And so I think bringing families into the conversation in terms of healing and hearing their voices is important as well.
Yes, so both of you bring up a great point, how it has to go beyond the school, right? We need a multi-pronged approach to this. So I guess the question would be like, since local and state systems set a bunch of guidelines for students, for school systems, like what could we do to hold these systems accountable? So superintendents and top down from there have to address these traumas.
Yeah, I think, that's a great question. I think one of the things we can do is show up. And when I say show up, I mean show up at school board meetings. One of the reasons why the anti-CRT sentiment has gotten so much traction of late is because you had a very vocal minority group of parents who have started showing up at school board meetings, showing up at superintendent's office, showing up at schools and demanding that CRT not be taught. The numbers aren't big, but they're just loud, vocal minorities. I think that's the same thing we have to do if we're really concerned about, making sure that the kinds of resources, and let's be clear, there's all kind of data that shows that California received billions in dollars from the American Rescue Plan tied to COVID. There's no oversight. There's no accountability as to how those dollars are being spent, where they're being allocated. There's no criteria. This is historic funding that's coming to our state. And what we don't know is the transparency that should exist about how spending is being allocated. There are schools that are in desperate need of psychiatric social workers. Are they getting them? There are schools that are in desperate need of having, mental health therapists and behavioral specialists. Are they getting them, right? These should be sort of some ways in which we start to show up and ask for answers and demand accountability and ask for transparency and begin to make sure that the folks who are in these positions feel the pressure from folks who say we demand and want something for our families and for our communities and for our children that we know so desperately need it.
Yeah, and I also think about this from the lens of learning that skill, like learning the tool of action and advocacy, because it's not something that is inherent to everyone. And oftentimes it's something that's taught. Again, we can think about the ways that we even teach students that, and the ways that teachers are modeling that, and the way that families are modeling that, right? So that critical action, I think, is really important as a form of exercising your agency, advocating, and in going to express and demand the things and your opinions and the things that you feel are needed in your community and for your family. And so I just think about the importance of that as well, in terms of modeling that for our youth and having kind of this tiered approach to even modeling, both in thinking about staff and schools, and also thinking about how we can encourage and help families to do that as well.
Mm-hmm. So, Dr. Saleem, you bring up a good point. Like we have to address these issues. We have to talk about these issues. And sometimes I wonder for classroom teachers, for example, like how can they address the racial trauma, the material conditions of young people without then trafficking in what some people call trauma porn or having young people relive some of these forms of trauma?
Mm-hmm. Yeah, I think, a lot of my work is on thinking about racial socialization and the multiple ways that some of this can be done, or discussed, right? And thinking about ways that we can equip students to respond. So there are ways to discuss, right? So providing affirming opportunities for students to engage in thinking about their own ethnic racial identity, right? So being able to have examples of affirming content or images or conversations related to their ethnic racial identity and culture. But then there's also this idea of having a safe space to discuss racism and to think about ways to be able to really analyze and respond to racism in different forms of systemic inequality that students see. And so I think that that can be done in curriculum, but I think that there are multiple ways that can also be fostered, right? So we can think about discussions, we can think about formal interventions that could do that. But I think that again, it doesn't all have to be in the classroom level. It can also be in this larger school level. Because socialization is happening beyond the classroom within the school context. I believe it's multimodal, and there are scholars that discuss this, right? So it's not just about curriculum, it's about interactions. It's about the image or invisibility of students within the school, thinking about ways in which what holidays are or are not celebrated in what ways, right? So there's multiple modes in which this socialization is being transmitted in multiple ways, where we can think about racial socialization as one form or one particular tool that is informing school racial climate, as well as interpersonal interaction. So when we think about addressing this issue, I think about ways that we can equip students with how to respond, where we can think about encouraging again, these system level changes as well. I think things need to be happening across tiers, but that healing can be thought about across multiple methods, including some of the things that we discussed here.
Can I build off of what Farzana just lifted up? Because that's important, that what her work has done really well is to show the importance of racial socialization as a buffer or protective mechanism for hostilities and traumas that students of color may face in classrooms. And if we're going to think about racial climate, improving racial climate, racial socialization can be a part of that. The challenge we have in that is that this is a need at a time when 80% of our classroom teachers are white nationally, and about 65% in the state of California are white. And, Christine Sleeter and Marilyn Cochran-Smith, Laurie Johnson, and others have talked about the ways in which most white teachers, not all, but most white teachers do not think about race, cannot talk about race, are not equipped to engage in any kinds of real reflections about their own racial identities. And so therefore, they're oftentimes ill-equipped to do those same things in classrooms where they are teaching racially and ethnically and linguistically diverse students. So while we think about the ways in which curriculum and interactions and expectations can be used as protective factors for racial socialization, students of color are most likely to come into contact with individuals who do not think about themselves as racial beings, who are not equipped to have those conversations, and therefore are lacking the resources, skills, and strategies to incorporate that into their classrooms. So this is why I come back to the need to think about how we, begin to think about how we prepare teachers and train teachers to ensure that they're given some kinds of resources, strategies, and skills about what it means to create the kinds of sort of racial socialization mechanisms that Farzana mentioned. But we also have to ask ourselves, what do we do to increase racial ethnic diversity in the teaching force? And that doesn't always mean, I want to be clear, doesn't always mean that all teachers of color have consciousness and awareness around racial socialization, because we know that many do not. But at least that kind of, it gives us a better chance to move to that point. So we have to come back to the ways in which we prepare teachers, how we prepare school leaders, because that classroom ecosystem is vital. And that classroom ecosystem is such an important space that can be affirming and uplifting, or can be dehumanizing and silencing for many students of color.
Mm-hmm. Well, thank you. Yeah, so I'm wondering if you both could also elaborate on the concept of racial socialization, like in particular the role that culture and race are used to address racial stress and trauma.
Mm-hmm. Yeah, so oftentimes from work of many scholars, thinking about racial socialization is often the messages, the behaviors, that parents are transmitting to youth about race, culture, discrimination, preparing for and managing racial bias, right? So there are folks like Diane Hughes and Howard Stevenson and folks who within the psychology field have thought about this within the family context. And there's also scholars that are thinking about this in multiple disciplines, right? And so thinking about the role that even education, when we think about racial socialization, I think oftentimes across a discipline using different words to describe similar practices, right? So when we think about things like culturally responsive education or pedagogy, when we think about Latson Billings' work or Gray's work, we can think about the ways in which different systems are providing messages to youth, and we're doing it as adults as well, right, about race and culture and racism in particular, right? So what are the ways that we are explicitly or implicitly sending racialized messages? And so we can think about some of the main content areas, for example, as building cultural pride, right? So what are ways that we can promote or build racial pride for students of color? So that might be verbal messages, right? It's saying you should be proud to be a member of your ethnic racial group. That could be, again, some learning about the history of your ethnic racial group and seeing how your group is resilient. It can be strategies around preparing for responding to racism, right? There are even strategies that for some communities of color have been adaptive, but may not have shown, may not be associated with positive outcomes, such as preparing, some socialization messages might be focused more on mistrust as a way to be adaptive and respond to things like racism or particularly like white supremacy, and thinking about how to address that from mistrusting and separating from other groups. So we understand the fact that socialization occurs in a multimodal way. So it can be verbal, it can be behavioral, it can be taking, again, actions, going to events, learning about history, but it is a part of this racialized experience and a part of understanding who you are and also understanding what that means in respect to other groups as well.
Yeah. Yeah, I would also add it's the visible and the invisible too. So it's those things that are not seen. It's not seeing, oneself represented in the curriculum. It's not seeing oneself on the murals in the school, or not seeing oneself in the hallways at school. It's the invisibilizing of young people that's important. That's also what Bettina Love calls the spirit murdering, right? It's the idea that, I'm told that my language, if it's not English, cannot be spoken in schools, in classrooms, right? Taking away a core part of my identity, that being my language. It's the way in which I'm not seen in classrooms. I'm not affirmed. I'm not complimented. I'm not called on to participate. I'm not being provided the opportunity for leadership. But then yet when I'm caught talking, I'm seen as a problem, or I'm looked at as being difficult. So I think it's the seen and the unseen. It's the heard and the unheard. And so some teachers who really who contribute to a racially hostile climate will say to themselves, well, I don't say or do anything that's mean or derogatory or hurtful, but what they fail to recognize and what they fail to understand, it's what they don't say that's equally as damaging. It's what they don't do that's equally as damaging. So sometimes it's the saying that, silence can kill, right? Being marginalized can harm. And these injurious kinds of acts, the most what they believe to be benign teachers who think that they're loving and caring and inclusive oftentimes do the most damage by essentially telling students through their actions and through their words that they don't matter.
Yeah, that's a great point. Sometimes the most well-intentioned teachers do the most damage, or just adults or people in general. So we have about 1 to 2 more minutes. I just want to open it up maybe briefly. You have hundreds of people logged on right now across the world. Like, what's something you would want someone to take away with, like one nugget for them to move forward with their own work in whatever capacity when it comes to working with young people?
Trauma matters. Trauma matters. Trauma is important, but not to look at trauma as being outside of schools. Trauma happens inside of schools. Let's not pathologize young people because they're going through various types of trauma, but that your role as educators, your role as leaders, your role as counselors, there's really no middle ground. You're either helping to affirm, uplift, and humanize young people, or you're playing a role that is injuring and contributing harm to young people. And I think we need to recognize it. I think we're in a moment now where we're finally lifting up the salience of trauma. We're understanding trauma and all its manifestation. But I'll close with this before I pass to Dr. Saleem. I'm oftentimes reminded of the work by Dina Simmons, who says that SEL has become so now widely accepted, but SEL minus a real anti-racism approach, she says, is like white supremacy with a hug. So let's make sure we're not engaging in white supremacy tactics with hugs because we say we do SEL, but we're not lifting up the salience of race.
That's good. I think I would also just, again, advocate for this idea that the healing has to occur across the different levels, right? And so oftentimes people want to say it's only about the system level change, right? Or we really need to focus on how we can help this child who's having a real crisis, who might be having suicidal ideation around a racially stressful, traumatic event that they're having. And I think that we have to think about the intersection of trauma and racism 100%, the importance of mental health, but then also the fact that we all have a role to play and that in the healing process, right? And then also that healing process has to occur across these different systems. It can't only be at one level. And so we all have a role in contributing to this healing.
Yeah. I want to thank our incredible speakers today. Dr. Howard, Dr. Saleem, thank you for giving us so much to think about. Thank you, Ruben, for being an incredible moderator today. I want this to be the first of many conversations that we have as a collective and as a group. The reason why we're doing this is so that we can build a collective group of people who are concerned with how to improve education for everybody. So we invite you all to join us as we move forward. I want to give a special recognition to Dr. Subini Anima, it's her birthday today, and she will be sharing with us tomorrow as we talk about critical race theory. We want you to really understand what the research says so that we can work through all of the noise to really understand. So thank you for joining us for our second to last session here. You'll get an email about the celebration for Latinx Heritage Month. We invite you to join us and share it widely. So thank you for joining us. We look forward to seeing you tomorrow. Have a great day.